Our discussion today is going to be an election year guide for the community. Really, we're going to be talking about what our advocacy strategy looks like in an election year. A very big thank you to our sponsors for sponsoring our educational programs. And a very quick reminder that we are not discussing individual cases today. Also, I think an important reminder because of the topic that we have to remember that the foundation is non-partisan and that our discussion will be about the facts of policy, how it works, the positions that we know are taken by public figures, and we're doing our best not to speculate today. And today we're joined by Philip Gogles, our managing partner at Health and Medicine Counsel and the foundation representative down in DC. Thank you very much, Phil. And I think with that, I'm going to stop sharing our intro here, and I think we can go ahead and get started. Hi, Phil.
Hi, Chelsea. How are you?
I'm doing good. How are you?
Doing well. There's
Yeah,
never a dull moment here in Washington, as we always say.
that's true. So, Phil, we've talked about what we're going to talk about today. So hopefully no major surprises, but I do want to remind everybody that if you want to ask a question, you can use the Q&A box down at the bottom. But also, we have a smaller group today. So if you want to ask a question by finding the raise your hand function, again, at the bottom of your screen, if you raise your hand, we should be able to accommodate some people asking questions live. I'll give you the ability to speak. So with that, let's get right into it. Phil, let's first talk about our own advocacy strategy, specifically HR 5818, which is to bring Medicare Part B access to home infusion of IVIG. What is the status and what does it look like for the rest of the year?
Thanks, Chelsea. So we've been very active on advancing HR 5818, our bill. And I know that many of you who are probably with us today have participated in our advocacy action alerts in the past for previous versions of the bill. But we've been very focused on advancing our bill in this current climate that we're in. It's no secret that there is a lot of up and down when it comes to Congress as a whole, especially when it comes to things moving through the floor. If you go back and look at what has happened last year with, the speaker election and the new speaker coming towards the end of the year, and just sort of where we are in terms of the calendar with a presidential election, the whole House up for re-election, and a third of the Senate up, there's just a lot of stuff that's been going on. But we have been successful in moving forward in a direction with our bill that we haven't before. We have strong commitments from Congressman Adrian Smith, who is the lead Republican of the bill in this Congress. Chelsea and I have met with numerous members of the Ways and Means Committee, which is the committee of jurisdiction, including the chairman and ranking member. We even had Congressman Adrian Smith at a hearing earlier this year specifically reference the bill and his desire to see it enacted into law as part of a larger package that Congress may be working on. But just unfortunately, where we are in terms of, is the bill going to pass today, tomorrow, or next week? Congress is very much in a holding pattern right now. The House left at the end of last week for the summer. They won't be back until September. The Senate is going to gavel out at the end of this week for the summer. They'll be back in September as well. And they're just going to work on teeing things up to keep the government open past September 30th. And then we'll see what happens after the elections and what sort of effect that has on any end of year packages. There's been a lot of discussion on rural healthcare needs because the chairman of the House Ways and Means Committee represents a large rural district in Missouri. There's been a lot of talk about different opportunities to bring healthcare into the home instead of just simply having patients go out and try to make things easier for folks. But a lot of that has sort of just been up in the air, nothing concrete yet, because there's a lot that will be determined just by the election in terms of what they do at the end of the year in terms of the spending creations, at the end of this year, or if that goes into next year. But we do have a strong champion in our corner in Congressman Adrian Smith, who again is on the committee of jurisdiction, a very senior member. And we do know that him and his staff are very determined to see our bill be enacted into law. It's just a question of timing that unfortunately is out of our controls at the moment.
So timing, that seems to be the thing that we're talking about here. And I'm kind of laughing because you said gavel out. So can you just remind us what gavel out means?
Sure. And that just means they go into recess for the summer. So the House is at home. They're back in their districts. They're not here in Washington, so they are not voting on any pieces of legislation. They're not holding any hearings. They're not doing anything here in DC. They're all back home. So if you're in Wisconsin, Texas, Alaska, Hawaii, your House member is back in the district for the month of August, and your senator should be back home within the next week because they're just finishing off some key hearings and other items this week, but then they head home at the end of this week for the summer.
So that sounds discouraging, but we'll talk about this a little bit later. This is actually an opportunity when representatives are home. That's a chance to get their attention that's non-Washington based. So we'll talk more about that a little bit later. So you mentioned appropriations a little bit. Can you tell us about why we advocate on appropriations and what do we advocate for?
Sure. So when you talk about appropriations, one of the basic functions that Congress does on an annual basis is fund the government. That is the one thing they absolutely have to do. So with pieces of legislation, you can introduce a bill to say the sky will always be blue. There's nothing that will make Congress have to act on that bill within a 2-year period, but every year they must pass appropriation bills which fund the government. And they're divided into 12 bills overseeing different federal agencies. We pay attention very closely to the defense bill and the labor HHS bill, which covers the Department of Labor, Health and Human Services, which is critical for us because the NIH, the National Institutes of Health, the CDC, the Centers for Disease Control and Prevention, they're housed at under the Labor H subcommittee. But then you also have Agriculture and Food and Drug Administration that we focus on as well, because that has funding and recommendations for the Food and Drug Administration, which is very important for us when we talk about different treatments coming to market and different approvals for drugs and things like that. So we pay very close attention across the board to all of the appropriation bills that are relevant for our community. And they're very important because they decide how much NIH receives in funding. So how much can they support in terms of research at the individual institutes. CDC, for chronic disease education and awareness, that program is funded at a specific number, and we want to, see that increase so that way there are more opportunities. The peer-reviewed medical research program, which is a list of conditions that are directly related to military service, GBS is listed as eligible for study. And in order to access the roughly $370 million of funding in that program, you have to be specifically listed. So because of our advocacy efforts, GBS has been consistently listed as eligible for study, which gives our researchers the opportunity to apply for grant funding and receive grant funding through that program. Actually, this week, the Senate is and Labor H bill. So those two will be critically important for us because we'll get to see the list of eligible conditions at the Department of Defense, as well as what their funding recommendations are for federal research activities across the different agencies that we work with and engage with. So having that funding is very important to pay for research and to be able to support some of these things. And then having specific recommendations like in the Ag FDA bill, Food and Drug Administration is very important as well because it helps to nudge federal agencies forward on key priorities to make sure that the work they're doing is what is most beneficial to the community.
When I think of appropriations, I always think of how it fills our research and our awareness asks within key agencies. Does that seem like a fair generalization?
Yes, definitely about how much money is spent and then specific call outs to our conditions to make sure that it's highlighted the importance of them and making sure that federal agencies follow through on key recommendations or support specific priorities that benefit our communities.
Yeah. And like you said, this is something that happens every year. So it's something that we weigh in on all the time, but it's also something that a lot of other groups weigh in on as well. So we look to other bigger organizations to see, that we're all saying the same thing and that our message is aligning. And that's where a lot of our advocacy work with coalitions and bigger groups is also useful so that we're not just one small group asking for this amount of money for the NIH, but that we're joining a group of people who are calling for robust NIH funding.
Right. So there's a lot of good work we do in coalition. The larger patient community supports, a very specific recommendation for the National Institutes of Health for overall CDC funding. Where we differ is we are the organization that ensures every year that GBS is included in the Department of Defense's peer-reviewed medical research program list of eligible conditions. So we work across the board, both in coalition, but specifically on the Hill for our specific interests. But we're very effective and efficient at being able to do that throughout the year. And as you mentioned, Chelsea, this isn't something that we do once every 3, 4, 5 years. It's something that happens every year, regardless of who controls the House, who controls the Senate, whoever the president is. It's an annual process that we always have to take part in.
Yeah. Well, that's a great segue into the reminder that it's an election year, Phil. But before that, I just want to mention that as a foundation, we're always looking for people to help us engage on this by writing letters to your members of Congress, which you can do on our website through our Advocacy Action Center. And a very special shout out and thank you to those people who worked with Ellie on our team to write letters to their senators to make sure that GBS was included this year. So we're very eagerly awaiting to see the results of that advocacy. So Phil, as I mentioned, it's an election year. Not sure if you were aware.
No idea.
But I think what's important, we should back up a little bit before we talk about all of the kind of nuances or start towing the line of speculation. And can we just talk about what happens when there is an election? What happens to the House? What happens in the Senate? What happens to administration? Just those basic civics 101 lessons.
So the House of Representatives is broken down into 435 individual districts throughout the country. So it depends on if you live in a high population state like California or Texas, there are a lot of different individual House districts in those states. But if you live in a smaller population state like Delaware or North Dakota or South Dakota, you only have one representative for the entire state. So every 2 years, the House of Representatives, all 435 members, are up for re-election. And then, of course, every 10 years with the census, you'll see changes in if a state gains seats or if they lose seats. And this most recently happened after the 2020 census, where a state like Montana previously only had one member in the House of Representatives, but because of an increase in population, they gained another seat. So now there are 2 House members from the state of Montana, while a state like New York, which has always had a large number of representatives because of the population, this past census cycle lost 2 seats because of a decrease in population. So the House is really, folks may have heard it referred to as the People's House and the People's Chamber, because it really is. They're elected every 2 years. They represent specific districts, and you may have in some states, like a Pennsylvania, somebody who's representing Philadelphia or Pittsburgh that has very different priorities than somebody who's representing Gettysburg because of different opportunities in terms of their local economy or priorities of that specific district when it comes to managing federal agencies or different issues that come up. So the House every 2 years is up for election. So this year, the entire House of Representatives, all 435 seats, are up for election. The Senate, on the other hand, is only comprised of 100 senators, so 2 from each state. So it doesn't matter if you're from California, Hawaii, Pennsylvania, Delaware, wherever, you have 2 senators. So each senator is elected to a 6-year term. So every time there's a federal election, there's only a third of the Senate that is up for election. You don't have it in the House, like the House, where the entire membership is up for election, and the Senate only a third is. So this year, not every senator is up, only a third of them are up. So it's roughly about 32, 33 every 2 years. And what that normally leads to is more of a pooling on the Senate side versus the House side, where the House is much more responsive to sort of the temperature of the day of the country, while the Senate, because they're there for 6 years, are able to sort of stabilize things and take a little bit more time to think things through and don't have to necessarily legislate public opinion the same way the House does. The presidency, of course, is up for election every 4 years. So the House, every 2 years is up, the Senate every 6, and the presidency every 4 years. So, in 2024, we have the trifecta. We have a third of the Senate up, we have the entire House up, and we have the presidency that's up for election. And of course, because of recent developments, it's now going to be a new president regardless come January 20th of next year. So what that means is next January, we will have new cabinet officials, so new secretaries of different federal agencies, new directors. In the House of Representatives, it depends who's in the majority, who has more seats versus the minority who has less seats. That will determine who chairs committees. So for instance, somebody like Congresswoman Kathy McMorris Rodgers, she's a Republican, currently the chairwoman of the Energy and Commerce Committee, which is a very important healthcare committee. She's retiring at the end of this year, so she will not be back in Congress come January. So even if Republicans still have the majority in the House come January, she will no longer be the chairperson. Now, if you look at the Appropriations Committee on the Senate side, for example, where Democrats are in charge, Senator Patty Murray from Washington is the top Democrat as the chair, and Susan Collins from Maine is the top Republican, the ranking member. So if Republicans win control of the Senate in November, Susan Collins will then become the chair of the committee in the new Congress, excuse me, while Patty Murray will become the ranking member or the vice chair because of the composition. So what we see every 2 years is control of the House or control of the Senate being up for grabs. And that determines who chairs committees, sort of what priorities will be and things like that. And that's why there's so much that's currently up in the air, because we just don't know who's going to be in charge come January and what ripple effect that will have on end of the year priorities or how they finish out the 118th Congress now before moving into the new year.
Yeah. So Phil, I just wanted to recap, because this was always one of the political science things that took me a while to grasp, is the concept of leadership within the House and within the Senate doesn't necessarily depend on the administration or who's in charge there. It depends on who has more seats in either of those houses. And because they have more seats, they have the privilege of determining who chairs committees and who sits on them. But all of that is, how is that all determined? Through, it's not necessarily appointments, but it's through a process. And I think we saw a couple years ago how messy that process can be when electing a Speaker of the House.
Yep. Yeah, so that last year we saw that, and it's very, it's see, that's how everything shakes out, making sure the numbers add up, and that's how they, tabulate vote counts before they put a bill on the floor. It's straight math. Do we have, in the Senate, do we have 51 votes for this? If we don't, then we don't put it on the floor because it's not going to pass. If it's something that needs a 60 vote majority, do we have the 60 votes? If not, don't put it on the floor because it's not going to pass. On the House side, do you have, 218 votes to pass a bill? If you don't normally put it on the floor because it's not going to pass and it's going to fail. So the leadership of the House and the leadership of the Senate is always independent of the administration. The one time the administration plays an important role is what we saw earlier in this current administration, the Biden-Harris administration, where Vice President Harris, as president of the Senate, was needed to cast tie-breaking votes because there were an equal number of Republicans and Democrats in the Senate. So every time that there was a tie vote, she would come in as the official tiebreaker and break that vote. But other than that, they don't have any role in the House. They don't have any role in determining who the leader is. All of that is done internally with the parties. And we saw this past Congress as well, a shift from former Speaker Nancy Pelosi stepping aside as leader of the Democrats and Hakeem Jeffries from New York stepping into that role. So if Democrats win the House, Hakeem Jeffries will become the new Speaker. And then on the Senate side, Mitch McConnell, who's been a longtime Republican leader, he's the current minority leader. If Republicans win control of the Senate, he's already said that he's stepping down as leader after the election. So they will meet internally and decide who represents them. But all of that is sort of inside baseball, which they do within their own ranks. But it really does, the only effect it does have is determining, okay, who serves on which committee, what are they going to focus on, who's going to lead those committees. And this is why it's always important to engage with your House member or senators, because you never know what committee they're going to end up on. They may be on something this year that's not relevant for our priorities, but in the new Congress, the senator might become a defense appropriator, which is very important for us, or they'll become an appropriator overseeing the NIH budget, or they'll be a member of a key authorizing committee or oversight committee. So it's always great to have those connections with each House member too.
Yeah. So I just wanted to send out a reminder that we are, as the foundation, completely nonpartisan. So all of these examples are all academic and theoretical by nature. And also, Phil, even if we wanted to speculate which way control was going to go this year, I don't know if we would be able to speculate.
I would not even try
Yeah.
because there's just been so much change that has happened in Washington over the years, and I don't think anybody can distinctly tell you today, here's who's going to be in charge of the Senate, here's going to be in charge of the House, here's who the president's going to be next year. There's a lot of time between now and November, so a lot of stuff will, play itself out and work itself out. I do want to stress sort of what you just did as well. For us, it's good to know who's in majority and who's in the minority, but that really doesn't affect how we advocate. We are very close with members of both sides of the aisle. We work very well with Republicans. We work very well with Democrats. We have support on all sides of the political spectrum. So this isn't an issue where our policies are determined by who wins the election. It's more of, okay, how are we going to approach activating and advancing our priorities given who's in charge? But we have strong supporters on both sides. If you look at our bill, for example, it's being led by Congressman Adrian Smith from Nebraska, a Republican, and Congressman John Garamendi from California, a Democrat. So everything that we do is very bipartisan in nature. So we're able to sort of rise above the politics of the day and really focus in on enacting those policies that will make the best difference for our communities.
Yeah, yeah. And it's great to be building those relationships over time because, like you said, you don't know where somebody is going to end up. And I'm just so proud of our volunteer community because we've definitely, over the past couple of years, been, I think, building those relationships more and more with a bigger presence in DC on our Hill Days, bigger Hill Days every year. So I hope that everybody will consider continuing to advocate with us. So I think we talked about, the leadership changes, and that's why the community wants to pay attention to the election. But we are an international organization. Do you have any thoughts on, why this matters for our international patients?
So I think it's always good to just keep an eye on things that are happening and sort of what domino effect I'd call that it has amongst other things. So, understanding who will be in charge, do they generally support cooperating with other folks and having a world presence? Again, we're not very much in that foreign policy space. That the area I would just look at would be, what does it mean for research and how can we look to the advancement of research, but also drug development, and what can we view as might get approved here that would be relevant internationally, or if there are things that are happening overseas that we can bring to the attention of decision makers here to say, we know that this is working somewhere else. We really want to see investment here so that we can have approval here or support the research being done stateside. So a lot of what members of the House and Senate focus on is how does a specific item benefit my constituency? How does it affect my community, my state? So being able to localize it is always important. But for the international community, it's good just to get a sense of where things are going in terms of the healthcare space. Are we going to see, an attack on healthcare in terms of protections for chronic patients? Are we going to see cost rise, or are we going to see any of these other barriers or barriers to access or barriers to treatment? That's where I would, fall on that. But definitely, we've been through many administrations where it's gone from Republican to Democrat, Democrat to Republican. By and large, everything continues to operate the same way it is. You may just have some small nuances in terms of different beliefs of how things should be done. But by and large, all of the systems continue to operate in a status quo type of way.
Yeah, that makes sense. I want to remind everybody, if you do have a question, you can type into the Q&A box at the bottom of your screen or find the raise your hand, and I can allow you to speak so you can ask your question live. But in the meantime, I think I have a couple rapid-ish fire questions to throw at you, Phil. And some of these, again, we have to try to not speculate too much, but rather think about the positions that we know are taken, or just think about historical precedent, even though we're very unprecedented times right now. But let's talk about the Affordable Care Act. You mentioned protections for chronic disease patients, and I think the ACA is one of the things that comes to mind there. Is there any reason to be concerned about the ACA or some of the protections that are embedded into that?
No, I think we saw back in 2017 and 2018 how strong the patient community was to come out in support of the four pillars of the patient community, ensuring, access to care, that pre-existing condition discrimination wasn't allowed, allowing young folks to stay on their parents' insurance until they were 26, and eliminating lifetime and annual caps. So healthcare is one of those interesting subject areas where it affects everybody. It doesn't matter where you live, what your political ideology or affiliation is, it affects everybody. So the way it gets sort of into the weeds is how to address it. But what we've seen here in Washington over the past few years is you may have specific areas that they may want to address, but by and large, a dismantling and an overturning the Affordable Care Act, I don't see that happening, especially with the margins in the House and Senate being as close as they are. I don't think there would be a bill that could pass and come into law.
Yeah. And again, that's another reminder of why it's so important for us to work with coalitions and large groups of patient advocacy organizations. So it wouldn't just be us, pointing out our concerns. We'd be joining a huge movement of patient advocates and patient advocacy groups who had concerns were anything ever to come up about the Affordable Care Act. Similarly, what about the federal funding? So we talked about appropriations, and we talked about, the DoD program for GBS and other peripheral neuropathies, and the NIH funding. Any prospect changes and how that might be affected with the election or a leadership change?
Nope, I think it's more of a question of when they're going to finish off this current cycle. The past few years, you've seen some very interesting outside of the box, I would call them, recommendations from the House, but those are more political in nature. The Senate has stepped in and ensured that, there continues to be robust bipartisan support. And I want to stress that too, bipartisan support for DoD, for NIH, for CDC. So I don't anticipate, a cut to NIH. I don't anticipate this elimination of programs. I don't see any of that happening. It's just a matter of when they will finish off the bills, and unfortunately that all just depends on what happens in November. If it's a situation this past year, they didn't finish them until March, which was well into the fiscal year, which starts October 1st. But we'll just see, after the election, do they finish it before the end of the calendar year, after the new administration is sworn in January. But we do anticipate, and I was on the Hill last week meeting with key appropriators, and very directly asked them what the status is and what will happen. And some of the proposals that we have seen, were they serious ones? Were they more political in nature? What can we expect? And I anticipate that we'll see a traditional bill be the final one. It's just a matter of when, not if.
Let's talk about the when for a little bit. Let's talk about when all of these things are supposed to be done versus when they historically end up done. And again, why an election has influence on the timing of some of this stuff.
Sure. So the appropriations cycle, and this may be a long-winded answer. I know these are supposed to be rapid fire, so folks just bear with me, and happy to go into more detail. But the appropriation cycle really starts in January. So once the new Congress is either sworn in, like they will next year, or they come back for the new session of the Congress, that's when the appropriations process really begins. The committees begin to gather different information, figure out, okay, where do we want our funding priorities to be? What are we looking at as a Congress? What issues do we want to tackle? In February, the administration releases the president's budget request. And this is a very large document that lays out what the administration recommends funding each federal agency at. It lets Congress know what the administration wants to focus on. So under President Biden, there was a lot of focus on cancer moonshot, because cancer research and cancer-related issues were very important to him because of the personal effect that cancer has had on his family. So he focused a lot in that space. There was also some other key initiatives that they wanted to see Congress support, that they would release that. The committees would then hold hearings where they would bring in experts from the federal government to see what they wanted to have spending on, what they were working on, get some indication of what is happening. As part of the president's budget request, they also have to share information with Congress, what they call justifications about, where they're spending the money that was appropriated to them the year before, specific recommendations, what actions are being taken. So it's really the administration's response to Congress to say, these are all the things you told us to do. Here's what we have implemented. Here's what we're working on. Here's where the state of everything is. During the springtime, that's when they start, having hearings and working through the bill. We start to see bill text and report language from the committee and things like that. In a perfect world, all of this happens during May. They release bills in June. They spend the month of July working on, having discussions within the House and the Senate. The House would pass all 12 of their bills. The Senate would pass all of their 12 bills. They would use the month of August to work out any differences that they had. They come back in September from their traditional August recess. And then by September 30th, they would pass all 12. The government would be funded starting the fiscal year October 1st, and there wouldn't be any issues. That's a perfect world. I get to see that happen. So how it has been happening lately is they still start in January. They still go through all of this. The president's budget request comes out. But instead of passing all of these bills by September, there are a lot of issues that come up. And oftentimes they've been passing continuing resolutions or CRs, which simply means we're going to take the current level of funding and we're just going to extend it to a specific period of time. So they might say we're going to have a CR, continuing resolution, until until November 30th. And that just means before November 30th, they have to either finish off all of the bills or pass another continuing resolution. If they don't, the government shuts down. And we have seen that play out in some different, aspects over the past few years. And that was one of the catalysts for the removal, allegedly, of Kevin McCarthy last year as Speaker. Was he put what we call a clean bill on the floor, where there weren't any policy writers, there wasn't any political division, there wasn't any of these items that could derail passage of a bill. It was the reality of the government needed to be funded, and he worked to put a bill on the floor that passed and kept the government funded, kept the government working, didn't lead to the shutdown. And because of that, there were some internal issues that he faced with his party. But where we are currently is the House of Representatives has, from the committee standpoint, reported out, which means the committee has done all their work on all 12 appropriation bills in the House. The Senate has been working through their process as well. And as I mentioned, they're doing some later this week. So the House will come back in September. They've tried to pass some of them on the floor of the House. They haven't had the luck. Again, it goes back to math. So what we've been hearing is, because it's an election year, they will most likely pass a continuing resolution at some point in September until after the November 5th election. We'll then see, probably right before Thanksgiving, if there's an ability to finish off the bills this calendar year, or if they may punt until sometime next year. There's been some conversation from some parts of the House Republican Conference that says that they want to pass a continuing resolution all the way through March of next year to give them even more time. There are some folks that say, put a full year continuing resolution, which doesn't lead to any increases across the federal government. But it's a little early to tell exactly when that will be. But if I had to endorse what I think is going to happen now, it would be that the House and Senate will pass a continuing resolution in September to keep the government funded past the October 1st, beginning of the new fiscal year, until after from there. But beyond that, it's very hard to pinpoint when the when is going to be.
Yeah. And a lot of this information about when the actual things happen, we're getting directly from the Hill. Can you just verify, a lot of these relationships are just from the offices that we talk to, and each office has their own deadlines for us to weigh in and things like that?
Yeah, so we work very closely with our champions on the Hill, and these are offices that we have longstanding relationships with because advocates have been engaged with them, or because we've had specific discussions with them over the years. Each office has their internal process to receive information. This year, Congressman Garamendi and Congressman Brian Fitzpatrick led a sign-on letter for us for our language priorities in the House and for a continued inclusion of GBS in the peer review medical research program. So everything that we do is with champions on the Hill, and that's where we get our information as well, by continuing to check in with them. So advocacy isn't sort of a one-off day throughout the year. It really is year-round, to make sure we continue to connect with, engage with, and just check in with our champions and with other members of Congress to just say, we know that this is where you are in the process. Just want to flag the importance of these priorities. We appreciate your support and encourage you to continue advocating for these key areas for our communities.
Yeah, again, those long-term relationships
Mhm.
are so valuable. So thank you for the detour there into all of the, the calendar questions, but let's go back to some of the rapid fire ones. We just had the 34th anniversary of the Americans with Disabilities Act. I think that was Friday. Does that sound right, Phil? And Ralph Neese was instrumental in a lot of that work and is a longtime friend of the foundation. Do you have any speculation on the Americans with Disabilities Act, the future of it? Is there any threat to it with any administration changes or anything like that?
So I don't think there's any threat to it. I think what we'd be looking at is sort of a 2.0 version to address what is different now than when the bill was originally passed. So I wouldn't see a situation where, Congress says we're going to completely gut this bill or this law and we're going to change it drastically. I think you may see additions to bring it up to date in certain aspects where folks may see it necessary. But I do know that the advocacy community around this issue is so large that Congress would never go in and propose gutting the law because they know what would happen. There would be so many stakeholders who come to them and share their frustration or disappointment with even the notion that they're going to make these, any large changes or things like that. So that I would view as more of enhancing, if you want to use that word in the future, or just saying, okay, what new obstacles does the disability community have that we should be addressing that weren't addressed the first time?
I think that's I feel similarly, and we're seeing, I think, a lot more vocalization around some of the things that are more modern struggles. The airline issue comes to mind, and I know that that's had a lot of national attention, and it's definitely an issue in our community, airline travel and some of the other access issues. So we'll be very eager to work with the patient community and lending our voice, again, not just through our own advocacy, but in joining in other large groups as to how the Americans with Disabilities Act can be maybe modernized is the right word, Phil, just knowing again that there's new modern struggles and access issues there. So I'm looking through my other questions here, and I really want to talk about, we've done a good job at trying to not speculate today. So, and that's a hard thing to do, especially with the news cycle and everything that goes on nowadays. Do you have any advice for the community on how to sift through the noise, kind of how to find the reliable information and how to be an educated voter in November?
So I think you cut out a little bit on my end, Chelsea, but from what I heard was cut through some of the noise and make the best decision possible. Is that correct?
Yep, that's it. Thank you. Sorry about my
Okay.
connection here.
So again, not endorsing one specific A over B or C over D or anything like that, but I just encourage folks to go out there and read what people who are asking for your vote, what they say, look at their records, what they do. Again, with Congress being home for the month of August, it gives you opportunities to participate in town halls that they may have or different events where you can ask them, where do you stand on these key issues that are important for me? And then make the best educated decision on that. In terms of our advocacy efforts and what's important for our communities, I strongly encourage you to stay current with foundation news in terms of, the bill moving forward or appropriations or things like that. Of course, the foundation will not endorse any candidates, will not put their finger on the scale for anything, but we're just giving you facts. So however you want to make your decision, I always recommend to always follow your instincts, have conversations with them if you're able to participate in any of these areas, meet them. They're going to be there. They're going to want to hear from you and hold them accountable. And at the end of the day, you're hiring somebody to represent you in the House for 2 years, or you're hiring a senator for 6 years, or you're hiring a president for 4 years. I think sometimes it gets lost that everybody who comes here to Washington and has their name on a plaque outside of a door and, can sit in a hearing room and ask questions, they work for the American people. And I don't want that to sound cheesy or anything like that, but it's true. If you don't vote, then, you can see differences. There was an election in Iowa a few years ago that was decided by 11 votes. And, 12 people, because you count the one, they gave them the one more, 12 people made a difference in who was representing them in a specific district. So every vote does matter. And I encourage folks to, I would say it's very tempting and very easy to go down rabbit holes or to, go into the unknown of things, especially given how much information is out there. But I would just say, trust your instincts and read up on candidates' websites, look at their records, ask questions. They want to be accessible to you. So sort of interview them and see where you land on folks. And, regardless of who wins, if you voted for me, but Chelsea won instead, that doesn't mean I'm a constituent of yours. These are the issues I care about. I want you to support them. That's what advocacy is all about. So it doesn't matter who you voted for. It doesn't matter who you wanted to win. Whoever gets to represent you is your representative. And, it's absolutely encouraged for you to engage with them. And I know that there are countless advocates who may not be of the same political party as their member, but they work well with them because they're supportive of our issues. And that's where we really focus on. It doesn't matter what you do 99% of the time when it comes to our priorities. If you're a strong champion, that's where we keep our focus.
Mm-hmm. And that's why we have to be non-partisan in all of this. And kind of as you were talking, it was making me think of a line from the show Ted Lasso of be curious, not judgmental. So kind of, again, digging into that curiosity and going into looking for the actual facts about somebody. But the most important thing, I think, is that everybody does take the time to make an educated decision and to vote in November. In the meantime, though, I want to talk about what we can do right now to help button up some of the issues that we've been working on a long time. And while you're answering the question, I'm going to lead you to an answer and share my screen about August advocacy. And I hope that you can tell us a little bit about why that's important and how people can get involved.
Sure. So I could not be successful in anything that I do here in Washington without all of you who advocate. I could go into, and Chelsea has been on the Hill with me for many years. We go into these offices, we have meetings. I could go into every single Senate office. I could go into every single House office and say, I need you to support these priorities of the communities. I need you to do this for the GBS-CIDP Foundation International. Most times people will say, that's very reasonable, Phil. You have our support, but there's always the one caveat. Is there somebody in my district or is there somebody in my state who can connect with me to share how this affects them locally and what effect this has on our constituency? That's what drives everything home. That's how we're able to have support from all corners of the country. That's how we're able to see these critical advancements and priorities. And that's because of advocates like yourself. And for those of you who haven't participated in an advocacy before, I don't want you to be scared off. It's very easy. And there are a lot of people who are advocates who don't even know that they're advocates or advocating. Anytime you share your story, you share your experience, you educate somebody on what your condition is or the condition of a loved one, and you give them that perspective, that's advocating, that's educating them, that's using your voice to help the community move forward. So I strongly encourage folks to sign up for August Advocacy, to contact Ellie to make sure that you're able to be connected. Is what leads to these improvements. This is what leads to our successes over the years. GBS wasn't always listed as eligible for studying the PRMRP. What we did was we went to the Hill, we made our case with the decision makers, we had folks reach out from key states, and that's how we got to be on the list. That's an annual list, so we have to do it every year. And the reason why we've been able to stay on that list is because of advocates who have reached out to the Senator Durbins or to the Senator Collins or to others on the subcommittee to say, this is something that's critically important. Please continue to support this. This is how we've gotten support for our bill, because folks have reached out and have said, Congressman Jones, I live in your district. This is what my experience with home infusion has been. A success story because I'm on private insurance, but I'm worried when I age onto Medicare, I'm not going to get it. Or I'm in the Medicare program. It was great when I was on private insurance, but now here's how it's negatively affected me. And this is why we need a change. That's what really drives everything home, because again, they work for you. So at the end of the day, their biggest focus is, how can I deliver for my state? How can I deliver for my district? How could I make sure that the people who sent me here, I'm representing them here in Washington? So I can't strongly endorse this enough. And this is the one thing I can say without speculating or without anything else. This is the one thing 1,000% you can do that will make a difference, and that's participate in August advocacy.
Thank you so much, Phil, for that endorsement. But I will share that every time you say the word endorse, I jump and hover over your mute button because I don't know what's coming up. No, I'm kidding. So Phil, I think that's a great wrap up to our conversation, but I do just want to give kind of a quick summary of all of the things we talked about today. That, there is an election happening, and what that means for us is that we are paying attention to see how the leadership changes, not because we are partisan, but because that ends up changing our calendar a little bit, and it ends up changing where we look to find new volunteers who might be interested in advocacy, just to help everybody get connected to their member of Congress, especially those who are in leadership positions. But of course, we want to hear from as many people as we can speaking to their representative. And that also, these long-term relationships with your members of Congress are so important, because you do never know what committee they're ending up on. And we are so appreciative to all of our advocacy volunteers, and we can't wait to continue to grow this network. So were there any other final summary thoughts you wanted to share with the group?
Nope, just want to thank everybody for being here. Always happy to answer any questions. And for those of you who might not be aware, Chelsea and her team with Ellie are very active year-round, ensuring that your voice is being heard on Capitol Hill with federal decisions that are being made, or policies that are being proposed, are beneficial to the community. We, of course, can't do that without all of you, so strongly encourage your participation. It may not mean coming to DC. It may mean sending a note, connecting with an office, but please do volunteer to be an advocate, because it really does help to make a difference in the lives of everybody in the communities.
Yeah, absolutely. So with that, I want to give a final thank you to our sponsors, and a thank you to everybody attending today. And a quick reminder to please visit our website for more information. On there, you'll find our Centers of Excellence program, other speaker series, support groups, both in person and virtual. We call those our chapter meetings, regional educational conferences, information about our upcoming virtual summit. There's so much educational information to find on our website so that you don't have to go through this alone. If you have any questions or anything comes up, the email is on the screen here. Otherwise, we can't thank you all enough. And Phil, thank you again for joining us for this conversation. Really appreciate your time.
Happy to be here. Thank you, everybody.
Thank you. Have a great rest of your day.